Bismillah ar-Rahman ar-Rahim. Thank you for the invitation for the second meeting for the MOCAT, and it's my pleasure and honor to be with you. Maybe the project of today is the subject of today is a little bit different, and it needs much more to understand what's the role of artificial intelligence in the diagnosis of diabetic retinopathy in Egypt. First, to start, what is artificial intelligence, or in Arabic that is الذكاء الاصطناعي. It's a problem, big problem عندنا في anywhere سواء في العراق أو في مصر. والبروبلم دي ليها دكاترة، والدكاترة مش عددهم يكفي إنه يغطي البروبلم دي. بروبلم موجودة في القرى والنجوع، وعايزين نوصل للمريض اللي عنده البروبلم دي ونقدر إننا نساعده بأقل عدد من الدكاترة حتى اللي مش sub specialized. دي فكرة artificial intelligence. It has been approved now for many diseases in ophthalmology, starting with diabetic retinopathy in the United States and in Europe, and now for glaucoma through the cup disc ratio only and the intraocular pressure, and again it has been approved for the keratoconus. So the artificial intelligence now is taking a good place in ophthalmology. So this was the idea and what we planned with the Ministry of Communication, who has a very good team for doctors who are dealing with the supercomputers to give data to these computers, and they build a program for the artificial intelligence. Let's see what happened. We would like to thank all the team, Dr. Nuha Adli, Dr. Marwan Turki from the Faculty of Engineering, the IT System Department, and Dr. Islam Shireen, Assistant Professor of Ophthalmology, and Dr. Shayma Al-Bassoon, who helped in the preparation of this presentation. So, as we all know, the problem of diabetes is a really big problem. 422 million patients with diabetes all over the world. This is really a big number. In Egypt only, we are 115 million population, and we have 15% of our population, they have diabetes. So it's really a big number, more than 15 million patients with diabetes in Egypt only. So the technology of just to take a fundus image, and it had been markedly improving, and there are a lot of cameras that we can do just fundus photography, and from this photography we can assess the diabetes, whether there is diabetic retinopathy or no, and what is the stage of this diabetic retinopathy. And the main aim of this artificial intelligence program is just to know whether these patients should be referred to hospital or not to be referred to hospital. What we used is the Optomed Aurora fundus camera, which is its specifications goes with all the specifications all over the world where they use the artificial intelligence technology. So the artificial intelligence technology in Egypt is an AI-based automatic grading system for diabetic retinopathy using efficient net for 10,000 Egyptian patients. So our project, we had convoys, and through our university we did convoys just to pick the diabetic patients and to take a photography for their fundus. And this photography, again, it has certain specifications. We can take just a central photography for the macula and the optic disc, or take two photographies. So again, it had been agreed with the other studies that just one photography for the right eye and one for the left is more than enough. As we said, the prevalence of diabetes in Egypt is more than 15%, and there is no Egyptian screening program for diabetic retinopathy for diabetic patients had been done till now. And this AI system is considered the first in the Middle East, and we had good results that I'm going to show you all of them now. So the aim of the study is to describe the development and validation, and the validation is the most important point, of an artificial intelligence-based deep learning algorithm for the grading of diabetic retinopathy and diabetic macular edema. So there were two entities, the diabetic retinopathy per se and the diabetic macular edema is another entity, and to compare the results of the manual grading to the known all over the world grading systems, and to compare this data set with our results, and to see the validity, which means the specificity and the accuracy of this program. So it's this artificial intelligence system program was based on the data collection from 10,000 diabetic patients and human grading. We had 14 graders, ophthalmologists, that had been certified, and have the data set from other studies all over the world, and to compare both of them and to make an artificial intelligence model. The data collection software developed to collect the fundus image, just the fundus image, nothing more, no fluorescein, no OCT, for 10,000 patients, and the patient information images were uploaded in a system, and this information had been examined with graders 3 times. Every picture had been examined 3 times, and if there's a conflict, there's an adjudicator who can make the more specific or more accurate راحت
لا عادي ركبها الصوت هذا اهم شيء.
الصوت هنا كان ماشي كويس، الصورة راحت.
اوكي ماكو مشكلة. شو المشكلة؟ ها؟ صوت منزلينه من هنا لاغينه. الصوت ما ادري بس طيب. بس شوف لا افتح دير بالك. اوكي هذا شغال. شو صار بعد المحاضرة؟ لا الصوت قاطعين عنه.
Going back to the presentation, so each fundus image was seen with 3 graders, and if there is a difference between the stage of the diabetic retinopathy or diabetic maculopathy, there's an adjudicator to see the difference. The grading was for R0 for normal, mild R1, moderate R2, severe R3, and prohibitive for R4, and diabetic macular edema 0, or if there is no macular edema, non-referable, or 2 if it is referable. The point is, as an ophthalmologist, we think that this is a very easy job to be done for any ophthalmologist, just to have a look to the picture to know this is diabetic retinopathy or not. No, the problem is it's not like the clinician point of view. It should be in another way, that it's based on learning how to grade this diabetic retinopathy. So all of us, we had certificates online from Gloucestershire University in the United Kingdom for 14 ophthalmologists, and they taught us how to do the grading for the diabetic retinopathy. It's not just for a clinician to see whether the diabetic macular edema or not, or the diabetic retinopathy or not. So the results on the AI system-based diabetic retinopathy data set, on 19,378 gradable images, we had on 10,800 patients, and the statistics for the diabetic retinopathy is shown in many tables, of course. I'm not going to bother you for these tables, but the point is that statistically it had been shown that the specificity and the accuracy of these results were very high. We solved the problem of diabetic macular edema problem separately. There is no conflict between both of them, and this AI model is based on deep neural network using the efficient net2 as a backbone. Again, we used pre-training on Kaggle Eye PACS, which is present on Google data sets, and we fine-tuned the model on the Egyptian data set collected earlier. Again, we found that the diabetic retinopathy problem after the tuning on Egyptian data had a sensitivity of 96% and the specificity of 95%, which is actually a very high percentage. Again, for the diabetic macular edema, it reached 95% for the sensitivity and the specificity of up to 94%. So to summarize, this AI-based model, efficient diabetic retinopathy, can be used with high accuracy for the grading of diabetic retinopathy and diabetic macular edema in fundus image. So you have a very small place where there is the computer system and this camera, so the GP, not an ophthalmologist, can pick up the fundus image and send it to the computer, and the computer send you back what is the result, whether to refer this patient to the hospital or not. And this technology offers the potential to increase the efficacy and accessibility of the screening system. And now we are planning to do it on 1 million diabetic patients in Egypt, divided on 10 universities all over the world, and all over Egypt. And this project is going on. It should start next year. And again, at the end, I know I take too much time, but we are surely on the right track. And I would like to thank you. Thank you so much.